heading down to Chattanooga, Tennessee for surgery on my iliac veins due to the compression. They are learning that COVID is not really a respiratory disease, but it is a vascular disease. And prior to COVID, the individuals that were doing this surgery were really only doing it on women who had had multiple pregnancies, which is what was causing the compression to their iliac veins. But post-COVID, they're seeing basically 50% men and 50% women because of the damage that COVID is doing to the vascular system. So I have compression in my iliac vein, and then I also have mast cell activation syndrome, which is dumping mass amounts of histamine into my body, which is aggravating my vascular system. And then I have the microclots, which is causing the mast cell activation syndrome because it's irritating that system. So it's basically just like a vicious cycle. So hoping that by getting the compression fixed, that will help the medications heal my vascular system. So I was able to get my mother and my husband's cousin were sweet enough to come stay with my girls while we went down to Chattanooga. We just drove it in one day, 'cause it's about 7 hours. So when you are out of state resident and you are doing the procedure, it's all in 3 days, like previously stated. So I went in and they put all of your information on a big TV screen. It's like huge, 3 feet, so that you can all see the same thing, which is really nice. So you can see any issues of the data that they put in to make sure it's all correct. And so you go over your medical history first with a nurse practitioner, and then they take you back for a pretty intensive ultrasound of your abdomen. Well, thanks. And so one of my biggest fears was that I would go in or I would drive all the way down there and they would not see any compression. So that fear was alleviated on Monday because they did see compression of both the right and left. And then they also look at your legs to see if there are any secondary issues that you're going to have in the future, which I did not. So that's exciting. I won't have to have a second follow-up surgery. And we'll talk about the rest next time.